Hand in hand with public safety are the human services necessary for people most in need. Over the last decade, human services in Illinois were challenged in two ways. First, by massive budget cuts, and then by the pandemic. Among the areas most in need has been behavioral health. In so many ways, the pandemic exposed the cracks in this system, leaving too many to deal with crises without any help. We've looked at ways, both big and small, to address these needs. Today in Illinois, there is no single consistent front door for young people or for families to walk through if they need behavioral health care. There is no central website that parents can search or phone number to call. Instead, they're left to navigate a confusing and overlapping multiple agency bureaucracy on their own. That's going to change. The FY24 budget invests $10 million to create our first care portal and resource referral tools for families seeking care. Through it, they can learn about the resources available to them and be matched with what meets their needs best, all in one place. Nearly a year ago, I launched the Children's Behavioral Health Transformation Initiative to evaluate and redesign the delivery of behavioral health services for children and adolescents throughout our state. This initiative recognizes that while DCFS and DHS are on the front lines of caring for our most vulnerable children, it will take a whole-of-government, interagency approach to truly provide the care that our children deserve. In alignment with the initiative's recommendations, we are investing another $10 million towards a 2-year expansion of the comprehensive community-based youth services program focused on youth aged 11 to 17 who are at risk of involvement in the child welfare system or the juvenile justice system. This funding will expand 24/7 services to youth, including assessments, crisis stabilizations, and housing. This fiscal year, for the first time in a decade, DHS began selecting children from the PUNS waiting list, a database that registers individuals with developmental disabilities to receive home and community-based care. This work must continue. Over the next fiscal year, DHS plans to offer services to an additional 500 children on the list. Remember, first time in a decade. It will provide these children and their families access to needed services and supports while decreasing the state's wait list for services. One of the most difficult challenges that we face right now in the field of social and mental health services are the critical worker shortages that we're seeing across the country. Let me be clear. There is no bigger challenge in this arena than the workforce problem. And we are competing with 49 other states to try and attract people to these jobs here in Illinois. Providing more competitive wages to develop and support our workforce is an absolute necessity. For the last several years, I've directed state funds towards supporting wage increases for our private sector provider partners, including those who work with the Department of Children and Family Services. That continues in this budget proposal. And an additional $120 million in the FY24 budget for the Department of Human Services allows us to continue rate increases to make Illinois more competitive in the market for workers who serve people with developmental disabilities. The investments that we've made in social service agencies over the past 4 years and that we're proposing for the coming year will finally have reversed the hollowing out that occurred in human services under the previous administration if we are able to hire up enough staff in this very tight labor market. We are cautiously optimistic that we can do so.